How to start a private home care provider agency in Georgia. Are you thinking about starting a private home care provider business in Georgia? You're in the right place. In this video, I'll give you a complete, practical, step-by-step guide to starting a private home care provider agency in Georgia. Let's get started. What is a private home care provider agency? In Georgia, a private home care provider, or PHCP, is an agency that offers personal care, companion services, and in some cases, nursing care, all in the client's home. Before you start, decide what services you'll provide. This choice impacts your licensing paperwork and your policies. A provider may provide 3 categories of home care services: personal care tasks, companion or sitter tasks, and nursing services. Private home care services does not include physical, speech, or occupational therapy, medical nutrition therapy, medical social services, home health aid services usually provided by a home health agency. Personal care tasks should be provided by a qualified patient care assistant who has successfully completed a nurse aid training and competency evaluation program, a competency examination for nurse aides recognized by the department, or a healthcare or personal care credentialing program recognized and approved by the department, plus 40-hour training program provided by an approved training provider, addressing at least the following areas: ambulation and transfer of clients, including positioning, assistance with bathing, toileting, grooming, shaving, dental care, dressing and eating, basic first aid and CPR, caring for clients with special conditions and needs, so long as the services are within the scope of the tasks authorized to be performed by demonstration, home management, home safety and sanitation, infection control in the home, medically related activities to include the taking of vital signs, and proper nutrition. Companions or sitters. Companions or sitters are not to provide other private home care services to clients unless qualified. Should be able to read and write, follow verbal and written instructions, and complete written reports and documents. Complete training or demonstrate and understand practical competency in the following areas: understanding the needs and characteristics of elderly, handicapped, or convalescing individuals, meal preparation and serving, transportation services, housekeeping to include sanitation, home safety, handling medical emergencies in the home, and infection control. Nursing services. Any persons employed by the provider to provide nursing services must be licensed in Georgia as either a licensed registered professional nurse or a licensed practical nurse under the direction of a supervisor. Nursing services include assessing the nursing needs of the client, participating in the establishment and implementation of the client's service plan, providing nursing services as needed and in accordance with the client's service plan, reporting problems and progress of client to supervisory personnel or the client's personal physician. Supervision of services. A supervisory home visit is required at least every 92 days from date of initial service for personal care tasks to ensure that the client's needs are met. Routine quarterly supervisory visits are to be made and documented in the client's file or service plan. A supervisory home visit is required at least every 122 days starting from date of initial service for companion and sitter services, or when the provider receives a complaint concerning services being delivered. All supervisory visits should be documented in the client's file or service plan. The supervisor should be qualified by education, training, and experience to supervise the provision of such tasks in accordance with accepted standards of care. If supervision is provided by a licensed practical nurse, the licensed practical nurse reports to a licensed registered professional nurse responsible for the development and management of the service plan. Forming your business. Step 1. Choose your business name. You'll want to choose a business name that's unique and not already in use. Step 2 is setting up your business legally. Most agencies choose an LLC for liability protection, but you can also form a corporation. You'll register your business with the Georgia Secretary of State, get an EIN from the IRS, and open a business bank account. Each year, you must file an annual registration for your LLC between January 1 and April 1. If you do not, your LLC will be administratively dissolved for failure to file your annual registration. Applying for licensure. Next, you must apply for a license through the Georgia Department of Community Health, DCH. Download the Private Home Care Provider Application Packet from their website. Link provided at the end of the video. It includes all the forms, rules, and a document checklist. Once your packet is reviewed, you'll first receive a provisional license. This lets you begin serving clients, but it expires after 1 year. Before it expires, you'll need an on-site survey to get your full regular license after serving 2 or more clients and before the provisional license expires. What you'll need for the application. 1. Completed application form with a description of services to be offered and the geographic area that will be served. 2. Date of electronic fingerprinting for owner or owners. 3. Application fee. 4. Licensing fee. 5. Copy of business license. 6. Notarized personal identification affidavit. 7. Days and hours of operation. And 8. Description of services to be offered and policies and procedures as required by the rules. For a complete checklist, type Private Home Care Program, page, and licensing packet in your search engine for a PDF copy that covers all initial licensure requirement. Link is also provided below. Policies and procedures. One of the biggest pieces of your application is your Policies and Procedures Manual. This shows the state how you'll operate safely and legally. Reference the actual Georgia rules when writing your policies. That makes life easier when the surveyor reviews your manual. Your policies must cover things like admissions and discharges, medication assistance, infection control, emergency preparedness, incident reporting, staff training and supervision, client rights, and confidentiality. Also prepare client service agreements that clearly state your rates and payment terms. Sufficient and complete application. Once an application has been determined to be complete, you will be notified and an administrative review of the application and documents to determine compliance begins. This initial review is conducted at the Healthcare Facility Regulation Division and may take up to 60 days, so be patient. A verification from the Office of Inspector General, Background Investigations Unit, of a satisfactory criminal background check on the owner must be received by them prior to issuance of the provisional license. Insufficient or incomplete application. If the documents submitted are not sufficient to indicate compliance, or there are missing documents or amendment needed, you will be notified in writing and you will be allowed a certain amount of time to make corrections. If corrections are not received within 90 days of the receipt of the application packet, the provisional license may be denied due to failure to demonstrate compliance with the rules and regulations. An option to withdraw the application voluntarily will be offered to avoid denial, as denial of the application may prohibit reapplication for up to 12 months. No refund will be issued for withdrawal. On-site survey and compliance. If approved, the initial provisional license is good for no longer than 1 year. The provider should be operational and begin providing services to at least 2 clients during the 1-year provisional period. When you've served at least 2 clients and are ready for survey, notify HFRD in writing. You must request your on-site survey before your provisional license expires. Surveyors will review your policies, staff files, and client records. They'll check for compliance with rules and regulations, implementation of policies and procedures, evaluate client records, interview staff, and make home visits and interview clients. If you're in compliance and no deficiencies are cited, you'll be issued your regular license. Deficiencies. If the agency is in substantial compliance but deficiencies are cited, the agency will be notified and allowed to submit an acceptable plan of correction within a specified time period. If plan of correction is accepted, a regular license is issued. Failure to demonstrate substantial compliance with the rules at a follow-up survey may result in subsequent rescinding of the regular license. Survey intervals. New agencies are surveyed for 2 consecutive years, which includes the provisional license review, first on-site survey, and 1 annual survey. After this 2-year period, periodic surveys are conducted if following criteria are met. A. The agency has had no deficiencies scoped D or higher for any surveys or complaint investigations over the last 2 years. B. There have been no adverse actions initiated against the agency. And C. No change of ownership has occurred. Periodic surveys are announced by letter at least 2 weeks prior to survey. Follow-up surveys are unannounced and are conducted based on the following criteria. 1. Any deficiencies related to patient care and supervisory visits. 2. 6 or more deficiencies cited. 3. Any deficiencies cited at the first on-site visit. 4. Repeat deficiency from previous year. 5. Any deficiencies that reflect the employment of unqualified staff. And 6. At the discretion of the program director or HFRD staff. Accredited agencies. Agencies certified or accredited by a certification entity recognized and approved by the Healthcare Facility Regulation Division, such as the Accreditation Commission for Healthcare, ACHC, Community Health Accreditation Partner, CHAP, and the Joint Commission. These agencies may be exempt from periodic surveys. The Healthcare Facility Regulation Division, HFRD, may still conduct a survey if determined necessary. Important tips. Renewal. Keep an eye for license renewal letters sent out at least 2 months prior to the expiration date of license. Unless the renewal application and annual fee are received within 30 days of receipt of the letter, the agency shall be considered voluntarily closed and are not allowed to continue providing services. Changes of ownership. If there's a change of ownership, the agency is required to submit a new application for licensure. Getting paid, private pay and Medicaid. Most agencies start with private pay clients, but you can also enroll with Georgia Medicaid. That means completing a separate provider enrollment process through GAMIS and sometimes contracting with managed care organizations. If you want to serve waiver clients, check the enrollment cycles for programs like Community Care Services Program, CCSP, or Services Options using Resources in Community Environments, SOURCE. Marketing and growth. To grow your business, build referral relationships with hospitals, doctors, assisted living facilities, and aging resource centers. Create a professional website, business cards, and a strong online presence. Word of mouth and trust are everything in home care. If you're ready to take action, I've made it easy for you. Here you'll find a full list of helpful resources, including links to register your business, apply for your EIN, rules and regulations, explore Medicaid waiver enrollment, and more. Starting a private home care provider agency in Georgia takes planning, paperwork, and compliance, but once you're licensed, you can build a business that makes a huge impact in your community. Thanks so much for watching. If you found this video helpful, give it a thumbs up. It really helps others find it too. Don't forget to subscribe so you don't miss out on more tips and resources. Looking for easy-to-use digital tools for managing home health? Check out my Etsy shop. Link is in the description. If you have questions, ideas, or want to share your experience, leave a comment. I'd love to hear from you, and feel free to share this with anyone who might find it useful. See you in the next video.